Hi, and welcome once again to Stop Sweating today. This time we will see how to stop sweating, all you need to know about excessive sweating. Severe sweating, clinically referred to as hyperhidrosis, is a serious medical condition that afflicts millions of people around the world. This condition can cause great disruption to your life, both socially and at a personal level, influencing your self-esteem and confidence in the process. This is why you need to learn how to stop sweating once you have been diagnosed with this condition. How to stop sweating. Types of hyperhidrosis. Hyperhidrosis can be classified as either primary focal and secondary hyperhidrosis. Understanding the difference between the two is a very important step when you want to know how to stop sweating. 1. Primary focal hyperhidrosis refers to excessive sweating that is not triggered by an underlying medical condition. This type of sweating occurs on specific areas of the body, and is usually symmetric, meaning that both the left and right sides of the body are affected at the same time. Some of the most focal areas that are affected by primary hyperhidrosis include the feet, hands, underarms and the face. This condition can begin as early as during your childhood or adolescent years. While suffering from this condition, you can experience episodes of sweating at least once every week. 2. Secondary generalized hyperhidrosis is the other main type of hyperhidrosis. This condition can occur as a result of an underlying medical condition. It can also be a side effect of a particular medication. Unlike primary hyperhidrosis, the sweating starts in adulthood and you will often sweat on larger or generalized areas of the body. In order to treat secondary hyperhidrosis successfully, it is important that you diagnose the underlying medical condition or the medication that is triggering your condition. How to stop sweating. Causes of hyperhidrosis. 1. Abnormal nerve function. Sweat glands are located all over your body, and so are the nerves that act as brain receptors. These nerves are responsible for communicating with the brain in order to respond to external stimulus through sweating. However, when the nerves are not working properly, then they may cause your brain to trigger a sweat as a result of inaccurate stimuli. 2. Poor brain function. Sweating is controlled by the part of the brain called the hypothalamus. This is the same part of the brain that manages thirst and hunger while ensuring that your body maintains the right temperature. If your brain is having poor sensory response, then your body may sweat profusely, especially if you are having an underlying medical condition. If you are anxious, stressed or depressed, then your mental function can be disoriented, resulting in hyperhidrosis. 3. Obesity. If you are obese, then you will most likely sweat more profusely than when you are not obese. This is because your sweat glands will tend to work extra hard to release excess minerals and water from the body, resulting in excessive sweating. Other causes of hyperhidrosis include hot weather, reaction to certain foods, heredity, puberty and menopause, and rigorous exercises. How to stop excessive sweating. Useful tips. 1. Antiperspirants. You can use these products to reduce antiperspiration by blocking sweat ducts on your skin. The main ingredient in most antiperspirants is aluminum chloride hexahydrate. Antiperspirants are the perfect remedy if you are suffering from mild hyperhidrosis. 2. Medications. If an antiperspirant fails to work, then you should consider seeking a medical solution for your problem. Such drugs decrease excessive sweat production by reducing the stimulations to your sweat glands. 3. Hyperhidrosis. This method is most effective for treating sweaty hands and feet. The affected limbs are placed in water and light electric current passed through. Hyperhidrosis takes 10 to 20 minutes and works by stopping sweat glands from excreting sweat. 4. Botox. Another effective method of reducing hyperhidrosis is the use of botulinum toxin type A, Botox. It is injected into the armpit to deactivate the nerves that are responsible for stimulating sweat glands. Hyperhidrosis can cause psychological and emotional distress. Depending on the severity of your condition, it is important that you diagnose the root cause of your hyperhidrosis in order to find the right remedy. If you need more information or want a definitive solution for sweating, you can visit my website. Here you will find the most powerful natural treatment for sweating that exists today. For your convenience, you just have to click on the red button pointing arrows.